Modified Dundee criteria for idiopathic intracranial hypertension is the official criteria used to diagnose idiopathic intracranial hypertension. In fact, the diagnostic criteria of idiopathic intracranial hypertension were first postulated by Dundee in 1937. These were later formulated into a set of diagnostic criteria by Smith in 1985. That criteria include signs and symptoms of increased intracranial pressure, headaches, nausea, vomiting, transient obscuration of vision, and papilloedema. Secondly, no localizing neurologic signs otherwise, with a single exception being unilateral or bilateral sixth nerve palsies. The cerebrospinal fluid can show increased pressure but no cytologic or chemical abnormalities otherwise. Normal to small symmetric ventricles must be demonstrated. So, how to diagnose idiopathic intracranial hypertension? The modified Dundee criteria include symptoms of increased intracranial pressure, which include headaches, tinnitus, visual obscuration, papilloedema. Normal neurological examination with the exception of sixth nerve palsy. Normal brain scan with the features of increased intracranial pressure. Raised lumbar puncture opening pressure of more than 25 cm with a normal CSF, and the patient is awake and alert. What is idiopathic intracranial hypertension? It is a rare condition but more prevalent in obese women of childbearing age. It may present for the first time in pregnancy, and pre-existing disease tends to worsen during pregnancy. The clinical features of idiopathic intracranial hypertension include generalized non-throbbing headache aggravated by coughing or straining and associated with diplopia in 38% and visual loss in 31% of the cases with papilloedema. Additional features of idiopathic intracranial hypertension include nausea and vomiting, back and neck pain, dizziness, and tinnitus. So, what visual changes are there in idiopathic intracranial hypertension? The common signs of idiopathic intracranial hypertension include papilloedema, optic disc swelling that is caused by increased intracranial pressure, visual field defect with enlarged blind spot, reduced visual acuity, reduced color vision, and sixth nerve palsy. The sixth nerve palsy is a false localizing sign and occur as a result of stretching of the nerve in its long intracranial course. What is the incidence of idiopathic intracranial hypertension? Idiopathic intracranial hypertension has male to female to male ratio of 8:1. The incidence of idiopathic intracranial hypertension in women of childbearing age is 0.9 per 100,000, which increases to 19.3 per 100,000 in obese women. What is the pathogenesis and clinical feature of idiopathic intracranial hypertension? The exact pathogenesis is unclear. It is thought to be caused by disordered CSF dynamics. It is unclear from the evidence as to whether it results from enhanced CSF production at choroid plexus or restricted CSF drainage at arachnoid granulation tissue. The lumbar puncture CSF opening pressure should be greater than 250 mm of water measured with a patient in lateral decubitus position to diagnose idiopathic intracranial hypertension. The CSF opening pressure measurements and the constituent assays are vital to confirm the diagnosis of idiopathic intracranial hypertension. Certain neuroimages are required for the diagnosis of idiopathic intracranial hypertension, like CT scan, which help to detect the hydrocephalus plus mass lesion, MRI for venous sinus thrombosis, and MRV for atypical cases of idiopathic intracranial hypertension. Monitoring of such patient is done by the multidisciplinary team of the doctors who do different growth scans and visual field testing. How to manage it? Management is by analgesics or by diuretics to reduce CSF production and dietary modification to aid weight loss. The surgical options include optic nerve sheath fenestration, CSF shunting via lumboperitoneal or ventriculoperitoneal route, subtemporal decompression of the optic nerve, and optic nerve fenestration, sheath fenestration. Therapeutic lumbar puncture is safe and can be done at any time during pregnancy. However, it is technically challenging in obese women. So thank you so much. That was all about modified Dundee criteria and a little bit about idiopathic intracranial hypertension. Subscribe on Obs and Gynae. Allah Hafiz.